When I say that the Agape Clinic is healing people, one patient I can remember, and I carry this story with me everywhere I go. One of our volunteers, Mary Horn, she was teaching a diabetes health management class, and she was working with one woman individually who was participating in this group class. And she looked at her and she noticed her age, and she was looking through her medical history, and she thought to herself, I wonder if she's had a mammogram. We signed her up for a mammogram, a free mammogram event. They found that she had stage 1 breast cancer. Mary spent hours on the phone, and so did the rest of our staff, working through this to make sure that this woman was going to be cared for. And literally, we saved a life.
To me, every day is a mission, whether I'm in my private practice or whether I'm at the medical school volunteering as a faculty member or whether I'm at the Agape Clinic. Every patient I meet is someone who needs something, who needs healing, who needs care, who needs attention.
Good job. Good.
A woman came from this church, Dorothy Flores was her name, and she said she was looking for a doctor to start a clinic in a Methodist church. And I was a Methodist, and I was a doctor, and that was the opportunity I was looking for. So I said, I am your girl. Take me and show me the place.
We walked in late one afternoon into Bill Bryan's office. It was a dump, I have to say.
And then they had a storage closet, which was about 12 feet by 13 feet, and there was a light bulb in the ceiling. And she took us into the closet and said, here's your clinic. I think we got the first exam table from a veterinarian. We put the exam table in the closet and had the fluorescent lights and a little sink and a refrigerator and a little cabinet. We opened up on August 19th, 1983.
It really is amazing to see and to think that it went from one little exam room and a desk out in front of that to now a place with 5 or 6 exam rooms, a much larger pharmacy, full-time people working here, thousands of people being seen beyond just Saturday mornings.
And the clinic evolved into a different type of facility after Charles Kemp came in 2000 and started to open more days, and we started to have more staff.
When I see the crowd out there waiting to get in, and I think it's marvelous that they all know. And we've tried to tell everybody, if you're ill, come to the clinic. They don't charge.
People come to the Agape Clinic because it has a tradition of an open door policy. It doesn't cost anything. You show up and they'll take care of you.
In our clinic, we see any patient who wants to be seen. In the beginning, we really saw urgent care. We did a lot of vaccines and a lot of colds. We really did not try to do any chronic management of chronic diseases like hypertension or diabetes, but we see a lot of that now. We have really increased our women's services this past year. Prior to that, over a several-year period, over the past 10 years, we have developed quite an impressive dermatology clinic with the sponsorship of UT Southwestern's dermatology department and Dr. Pandya. We have a new eye doctor who's going to be starting to offer eye care in the clinic, which is really helpful for us because we are doing so much more chronic disease, and we're taking care of diabetics who definitely need to have regular eye exams. We do allergy skin testing, we do asthma care, asthma testing, and following patients with asthma with their medications. We are giving immunotherapy shots in the clinic now.
Grace United Methodist Church has always been aggressive in their faith aspect of building and remodeling. They are working hard to do this renovation to a second level and build the clinic even bigger.
The clinic is now still functioning in those 5 rooms now. It's almost 20 years later, and we're really busting out at the seams. So we have come up with our new plan, which is very exciting.
The new plans have us expanding into what is now our current waiting room area. We're going to build 6 new exam rooms. One of them's a larger space, and that room is going to be used for group counseling, family counseling, It will also be used for specialty services that require larger spaces, a new lobby. We've also added some additional an additional workstation for our volunteers to write out prescriptions, to chart, and also additional hand washing. Just by expanding our hours, we will hit probably at least 1,000 more patient visits this year, just by seeing everyone who showed up.
When I come here today and see the number of volunteers that are here, it's incredible to think of the opportunity this has had to minister not only to the patients, but to all of these volunteers.
We use volunteers for just about everything. We have volunteer nurses, volunteer nurse practitioners, volunteer doctors, volunteer service staff and intake staff and clerical staff and accounting staff, without whom this clinic simply could not function.
Where's your head hurt?
With this new expansion, it's just going to be incredible, and to think that, you know, it all got started with one woman, a desire to help, and one room. It's just incredible. Obviously, we all know that Bobby has been here and really was the driving force behind this, but right along with her was David. Every time she was down here, I saw him, and talking about being the loyal, loving, supportive spouse.
I'm just a small part of this ministry. I might have been the little engine that could in the beginning, but what keeps the clinic going now is a whole lot of people, and I just come down occasionally and do my little part. So it's just a lot of joy when I think of what it's grown to be and how it will continue to go.
People ask, what type of emotion do you have when you walk in to the clinic? Well, you should come down and look into the eyes of the people who are sitting in line. It's really incredible. They're there waiting, and you're there, their only hope.